Hello and welcome back to On the Couch with Nikki, where I bring you experts for expats. This episode is brought to you by Expat Dental, your one-stop shop for all your dental needs. So, who's with me on the couch today? I have Dr. Michael Bryant, or Dr. Mike, from Elite Spine Centres here to talk about how your spine is directly linked to your well-being, including your lifespan. Let's have a chat. Dr. Mike, most people come to see a chiropractor when they're in pain. Is that the role of a chiropractor, to alleviate back pain?
I think people that aren't familiar with chiropractic think of generally back pain, neck pain, headaches, sciatica, maybe slip disc, you know, all of these physical symptoms that people arise with. And yes, we do help those. But really what I explain to my patients when we consult is that fixing these problems is really more of a side effect of the treatment or the process of chiropractic rather than the main goal. But chiropractic is really built around the understanding that the nervous system, which is our brain, our spinal cord, and all of the nerves that run throughout our body, is the master control system of the body. And that's acknowledged within pretty much any field or branch of medicine in the world. So when we recognize that the nervous system is controlling and coordinating all of these functions, the spine or the backbone just so happens to be what protects that vital nerve system. So I think most people can quite get behind the idea that if they have distortions or dysfunction in that spine, it's going to influence in a negative way that nerve system that we talk about. When you tap into that nervous system and help it to communicate more freely, which is really the core tenet of chiropractic, you know, these pains tend to heal themselves, as we say, but also other things. People often come back to me after we've been working together for a couple of months, and they'll notice many things that maybe they didn't even mark on their intake forms and say, hey, I noticed my digestion seems like it's working better, or I had asthma on and off for many years, or allergy issues, even immune system issues. People get sick more frequently. So many different things that people wouldn't associate right away with chiropractic work or the spine, that tapping into that nerve system can actually bring about large changes.
Can somebody presume that if I'm not in back pain, that everything's okay?
Part of our goal is to educate people a little bit more about why they should be having checks usually before they're in pain, as part of more of an overall lifestyle, taking care of what we call their mechanics, or how the spine is moving, proper posture, and how these things relate to their physiology, how they feel. We try to educate people of why spinal health is linked to many other things that they will feel down the road.
Okay, so when you say spinal health, how do you define a healthy spine?
Obviously from the front, most people know we want to have a straight spine. So that's one component, is posture, essentially how we carry the body, but also how it moves. So we're animals built for movement, you know, both our spine and our body as a whole. How your biomechanics of the body and the spine, we know to a high degree now influences not just how we feel over the long term, but how much degeneration we're likely to develop, and how likely we even are to have other disease processes starting. We try to find these issues as early as possible, usually before their symptoms, and it's much easier to correct and teach them lifestyle advice at an earlier stage.
How can it increase our lifespan, having good posture?
This isn't something come up with by the chiropractic profession. So this is actually something published by the Journal of the AMA, American Medical Association, where they acknowledge that posture distortions, or poor posture, can lead to a host of morbidity, which means different illnesses that are not even related to the spine or to the body that we would think of. And they've acknowledged that it also can decrease or shorten lifespan. That by itself is a significant reason people should be getting checked earlier in life, when there's still plenty of time to course correct. Almost everyone out of the thousands of patients I've personally worked with, I've yet to ever find a perfect spine. So everyone has stress accumulating in their body. It's a matter of to which degree and which area. One very common thing is pelvic distortion or pelvic rotation. So when I watch people walking out you know, in Singapore, I see it plain as day. So all the people with over rotation in their hips, or how their foot rotates when they walk. This is setting you up for damage and for eventual pain and problems like even slip disc, you know, more serious issues down the road. These things are almost always present, sometimes for years or even decades, before it finally arises as a symptom.
Yeah.
So almost everyone has some degree of sinister process happening in their body. It's a matter of at which point are they going to eventually feel pain or problems.
It's like a car. We need to be serviced.
Exactly.
We don't necessarily need to wait until things pack up and then we need to get the car looked at.
The body is also a very complex machine that we use every single day.
Yeah.
So why we don't think that it should also have some service and maintenance is kind of interesting, don't you think?
I do. Very interesting.
Yeah.
Should children have their spines checked to see if there's an issue?
Yes, absolutely. I mean, anyone that has a spine should be getting checked periodically. It doesn't mean necessarily any work needs to be done. But the earlier you look for problems or look for ways to course correct, the easier it is. I mean, a simple analogy is like a sapling tree. When you plant it, they usually put a stick on it when it's growing, correct? To try to keep it straight as it gets older.
Yeah.
So it's much easier than trying to correct a bent tree 20 years down the road.
Apparently sitting is the new smoking. So are these standing desks advisable?
Yes, so that's one of the things. And it's not just for spine or back related problems. They're actually finding other long-term health issues, blood pressure, and other things that are being affected from sitting too much. So
Students should also be standing at desks at school? That's a lot of hours sitting, isn't it?
Yes, so that's something we need to look at, I think, as a society, is how we can build variance into the tasks of what we do day to day.
Is it a misconception that when one goes to the chiropractor, you have to keep going every fortnight for the rest of your life?
There's usually a short period of correction. So we have in the beginning more of a correction phase where, yes, it's more intensive. We see them repeatedly. We start teaching them exercise to supplement what we're doing.
Yes.
My goal as time moves on, if they would like to take care of themselves over the long term, is to slowly teach them ways to do these things on their own.
Is there a negative side to seeing a chiropractor? Is there risk?
I would say any intervention, any medical intervention that has potential to help, there's always some risk involved. If it can help people, it can harm people. But I think if you look intelligently at the numbers, I would take the risks of chiropractic that's well administered over pretty much any medical intervention or medications that are out on the market today.
You said well administered. Are there chiropractors out there that shouldn't be chiropractors or shouldn't be practicing or aren't administering this treatment well? How does somebody know?
I came from the United States, where chiropractic is it's one of the only countries where chiropractic is a full doctorate level program.
What credentials should somebody make sure their chiropractor has to ensure they're going to a credible physician?
So in Singapore, it's a little more difficult because the profession is, as of yet, still unregulated or somewhat unrecognized.
Wow, unregulated. That's a little frightening.
Most of the chiropractors advertising themselves as such here do have proper training and credentials, but you have to understand we have people from many different countries practicing here. The academic credentials, licensing requirements are a little bit different in all of these countries. So in Singapore, I think it's really important people, again, do their due diligence and make sure they're seeing a chiropractor who's properly trained, has completed a course of education, licensure requirements, and so forth. The terminology chiropractic itself is not protected, such as physiotherapy. You know, you have to be registered as a local physiotherapist.
We're not talking about a hairdresser here. This is somebody that's dealing with your spine. That's really important to know.
And it's something that I hope in the near future moves into that direction, where the terminology and the educational standards are recognized and protected.
But for now, people need to make sure they're seeing a qualified professional.
That's correct. With Elite Spine, my goal is to create more of a hybrid center where patients can have not just modern qualified chiropractic care, but also other therapeutic techniques, lifestyle advice, rehabilitation, exercise, really all in-house. As important or even more important over the long term is what we teach people as far as how to take care of themselves, how to maintain the effects of what we're doing. That's really where people get this long-term benefit and much more valuable than just another therapy that they go and do.
It's really important to make the spine a priority in your wellness program. It's also important to go to a chiropractor that's reputable and credible. Go see Dr. Mike at Elite Spine Centres. He'll give you an honest appraisal and set you on a treatment plan that's right for you. Thanks everyone. See you next time.